Now, by far the biggest study carried out into COVID-19 was published by the Chinese Centre for Disease Control on Monday, 17th of February, and it collected data up until the 11th of February. So this is the title of the piece of the paper. So the background that they give is an outbreak of 2019 novel coronavirus, now we call COVID-19 disease, in Wuhan, Hubei province, China. And they report it spread quickly nationwide. So there's no hiding here. This seems to be an honest report to me. That the data is incomplete, but it's honest as far as it goes. Now, descriptive exploratory analysis of all cases diagnosed. So this is descriptive. It's not like new research. It's retrospective. And they're exploring all of the cases. But this is the key thing. The reason I like it so much. All the cases that the Chinese CDC, Centre for Disease Control, have identified. So they identified all cases, and then they took a summary of patient characteristics, examination of age distribution and sex ratios, calculation of case fatality and mortality rates, geotemporal, that's geographical where it is, analysis of viral spread, epidemiological curve construction, whether it's going up, down, staying the same, and subgroup analysis. So it's going to answer a lot of the things that we've been wondering about since we started making these videos. And we're actually going to get some fairly definitive results from this paper. So these are the results that they came up with. The number of cases they identified was 72,314. Now that is a good sample size. They're not saying it's all the cases. I'm not saying it's all the cases. Everyone knows it's not all the cases. There are many more cases than this, everyone acknowledges, but this is where we have data. And if you're looking for something, you've got to look where the light is. There's no point looking in a dark bit. So 44,672 confirmed cases. So 61.8 of the cases were confirmed with the definitive diagnosis identifying the virus. This polymerase chain reaction test, which is the only one still that we have. So that was confirmed cases. These were suspected cases, but we know now the Chinese clinicians are quite good at what they're looking for. And in Hubei province only, what happened was they ran out of test kits. So they were diagnosed on clinical grounds in Hubei province. So they diagnosed them with test kits, yes, but they also diagnosed them clinically, but just in Hubei. But the expertise was there to do that, so I'm quite happy with that as accurate diagnosis. Now, this is concerning. 889 were asymptomatic. So 61.8 confirmed, 22.4 suspected, 14.6 clinically diagnosed, but 889, 1.2% of cases were asymptomatic. And of course, these can still spread the disease. This is the key issue. Now, of the cases that were confirmed, 74.7% were diagnosed in Hubei province. And of the cases that were confirmed, the death rate was 2.3%, 1,023 deaths. Case fatality rate, 2.3% overall. Now, we know that this is, or we believe this is artificially high, because we believe there was a large number of less severe cases which weren't diagnosed. And that will bring this down quite a lot. How much? We don't know, but this is the data we have. COVID-19 spread outward from Hubei province after December 2019. This is now known and acknowledged. By February the 11th, which is when this paper collected data up to 2020, it was spread across virtually all of the counties in China, and all of the 31 provinces in China were affected. So a lot of national spread. And this is particularly disturbing. 1,716 health workers have become infected. Now, because these are mostly in the younger age range, as we'll see, I'm not going to say only 5 died. There was 5 tragedies, but 5 out of that number is relatively small, and that represents a case fatality ratio of 0.3%. Now, one thing I've been concerned about since the start of this is the apparent relatively large number of severe and critical cases. Because these percentages don't look very high, but when you think that we could be dealing with tens of thousands of people, they are high. So let's do with the good news first of all. 80.9% were classified as mild. And as we've said, there was probably many that were asymptomatic as well, or even milder, that were never diagnosed. So hopefully that number is quite a bit higher than that. But we don't know. This is just what we know. The rest is speculation and mathematical modelling. But the mathematical modelling does show that the number of milder cases and asymptomatic cases could be much higher than that. We looked the other day and saw that the cases we see of are the tip of the iceberg, but the more severe tip of the iceberg, the more severe cases. So cases from this cohort that were classified as severe were at 13.8%. Now, I'm not quite sure what criteria were used here. They don't specify that, but to me that would mean they were poorly enough to need additional oxygen, certainly. And this is going to be a problem because if a lot of people need oxygen all at the same time, that could be a significant difficulty for a local healthcare facility. And critical, these are people that needed high flow oxygen or intensive care, 4.7%. And of course, the case fatality rate is going to vary massively depending on how we manage these. So if the overall case fatality rate, I think I said, was 2.3%, if it hadn't been for the high quality healthcare provided by the hospitals and the amazing new hospital they built and all the emergency things they did and all the emergency medical staff they flew in, then the case fatality rate would be way, way higher. So these cases, probably quite a few of these, had their lives saved by medical intervention, and all of these would have died without medical intervention. I think that's safe to say. So the percentage of severe cases is still quite a major concern that I have personally related to healthcare provision. Now next we go and look at age. And here we have the age in this column. The N, that's the number, the percentage, and the case fatality rate. Now, immediately we were encouraged because only 0.9% of cases were younger than 10, and there was no fatalities in that group that are recorded. So quite encouraging, really. Age 10 to 19, again, relatively low percentage, 1.2%, case fatality rate of 0.2. 20 to 30-year-olds, getting nearer the normal adult range now, 8.1%, 0.2. So what we're assuming is that these younger people have very good immune systems and are able to combat the virus effectively, which is very good news. And that the healthy immune system doesn't seem to cause a disproportionately inflammatory reaction, which could cause more problems. Inflammatory fluid collecting in the lungs, which is what we don't want. So 30 to 39, we've got 17%. Again, case fatality rate relatively low, 0.2. 40 to 49, percentage now are increasing, 19.2% of those affected. And of those, 0.4% case fatality rate. So 0.4 of those died. 0.4 of that number. 50 to 59-year-olds, 22.4% of those recorded. Case fatality in that range, 1.3%. So 1.3% of those died. 60 to 69, 19.2% of the sample. Again, 3.6 of that number died. That's the case fatality rate. So going up quite significantly now, we've got over the age of 60. 70 to 79, 8 of those, 8% now, 8% of those died. So a much higher percentage dying in the older age range. And over 80, it was 14.8% of those died. So the risk is increasing with increasing age. I think we can now say that fairly clearly. The risk is increasing with increasing age. Bad because we're losing older people. Brilliant because we're less likely to lose children and younger people. And of course, the older people get, the more comorbidities they're likely to have. If you haven't got a disease now, just wait for a while and you'll get one. You know, if you live long enough, you're going to get diseases. Not many people live disease-free and then die all of a sudden. Diseases tend to become more prevalent, so these people would have more diabetes, more heart failure, more hypertension, more chronic lung disease. Any chronic disease you care to mention, really, the incidence goes up with increasing age. Now, this statistic at the bottom here, male-female ratio. So these are the numbers of men, the collected data from the confirmed cases. These are the numbers of females. And these figures are pretty well... I don't think the difference between those, it might be significant, but it's pretty close, isn't it? So I'm happy to say that men and women are affected roughly equally in terms of getting the infection. But the case fatality rate in men is higher. So 2.8% of that number of men died, whereas less, 1.7% of that number of women died. So from this, we see increasing case fatality with increasing age. Younger people, much less likely to die. Men, from this, more likely to die. Women less likely to die, but similar numbers of men and women infected. Now, their conclusions from this study. COVID-19 epidemic has spread very quickly, taking only 30 days to expand from Hubei province to the rest of mainland China. Pretty fast rate of spread. China needs to prepare for possible rebound of the epidemic. Now, I don't quite understand this, but they're saying that there could be more cases to come, certainly. And the other thing that concerns me is the virus could mutate. And there's a lot of copies of the virus around now. Now, if a virus mutates, it can become less virulent, less infectious, or more virulent and more infectious. But of course, if it becomes less virulent and less infectious, that strain of the virus will die out. Whereas a mutated strain of the virus that becomes more virulent and more infective is likely to do more damage and spread to more people. So they might possibly be thinking about mutation changes there in the risk of rebound. So I'm going to leave that video there as a single study. Lots of useful data now. This is fairly definitive data, and I'll put the link for this in the notes for this video so you can refer to it yourself. There's a lot more information I haven't covered. That's just a quick sketch of it, but some very important concrete facts now starting to come out, and I've no reason to think why these numbers shouldn't be very similar in any country where this is infected, in a country where it comes, with the proviso that there could be a lot of mild, undiagnosed cases or more asymptomatic cases. But again, we have proof here that there are asymptomatic positive cases. But these numbers, I wouldn't be surprised if they're the same as we get in my country or your country, should this outbreak become a pandemic.